Hi, I'm Stacy,
And I'm Melissa.
and welcome to the Digestible Podcast, where we give you the information you need in the amount of time your day can handle, and we make it easily digestible. Get it?
So, Stacy and I, for those of you who are listening and not watching, are in the same room.
That never happens.
That never does. And we're very excited. Stacy, why are we in the same room?
We are in the same room because we just spent the past 2 days at the Personalized Lifestyle Medicine Institute conference here in the Chicagoland area, where we got to hear from some amazing doctors and researchers all around health and wellness.
Yes, including a very special speaker, the grandfather of functional medicine, Dr. Jeffrey Bland. So that was like celebrity sighting, very exciting for us.
It certainly was. And today we're bringing you one of my personal celebrity favorites, Dr. Leslie Mendoza Temple. Dr. Mendoza Temple is the Owen L. Kuhn Endowed Chair of Integrative Medicine and Medical Director of the Integrative Medicine Program at Endeavor Health. She is also a professor of family medicine at the University of Chicago Pritzker School of Medicine. She combines modern Western medicine with evidence-based complementary therapies to achieve optimal health and symptom reduction. She completed a 2-year fellowship in integrative medicine at the University of Arizona under the supervision of Dr. Andrew Weil, internationally recognized as the lead pioneer of integrative medicine.
So we hope you enjoyed today's episode with Dr. Temple.
Welcome back, Digestible listeners. We are here today with Dr. Leslie Mendoza Temple. She is a phenomenal doctor and one of the most amazing humans I know. And full disclosure, Dr. Temple is my physician, so she is extra special to me. I have been a patient of hers for over 13 years. Not many of you know this, but I was diagnosed with breast cancer over 13 years ago. And one of the first things that was recommended to me that by someone who works in the cancer wellness space said, I want you to do 3 things. I want you to go see Dr. Leslie Mendoza Temple. I want you to start acupuncture, and I want you to go see an oncology nutritionist. And that's how I came to be Dr. Temple's patient, and I am so grateful that I am. Welcome to the podcast.
Thank you for inviting me.
So before we get started, let's talk about what is integrative medicine, because not everybody seems to know. So tell us what it is and what it isn't.
My short quote for that would be the use whatever works. But expanding on that, it's a thoughtful combination of evidence-informed complementary therapies. We used to call it alternative medicine, but that's no longer a favorable term. But even complementary is a little suspect, but adding therapies that were not considered in the mainstream Western paradigm of allopathic medicine, combining that with conventional Western medicine to create a more well-rounded package for a person who's going through any kind of illness or they're trying to be well. So we're using therapies from the traditional Chinese medicine realm, Western herbal medicine and supplements, homeopathic medicines, good nutrition, movement, of course, stress management, combined with your prescription meds or referral to the surgeon or oncology treatments, where you're combining everything as much as possible, hence integrating different forms or different concepts of what is considered medicine. Integrative is a term coined by my mentor, Dr. Andrew Weil, who started the University of Arizona Integrative Medicine Fellowship Program back in 2000.
So if I was interested in integrative medicine, just sort of as a general way to get medical care, could I come to you like I would go to an internist, or do I need to have a specific problem or health goal in mind?
The answer is yes. Which is not very specific, right?
Okay.
I'm a board certified family medicine physician. So primary care is in my blood. I'm all about preventive screening, getting your mammograms, your colonoscopies, making sure your blood pressure is good. All the things that a great primary care physician will take care of, in addition to problems that arise. But in my practice, I'm not able to do everything that a primary care physician does, but nor does a primary care physician. They're not typically able to handle the things that I handle, which is complex medical management using holistic therapies. They can manage everything. A good primary doctor can manage, they say, 80% of what walks in the door. I'd rather share you with your primary doc so that we can be all those things to you. It's very hard to find a physician who can be all those things, holistic, integrative, and primary care in once. I'm sure there are unicorns out there, but they would need a lot more time in a visit to finish all of that.
Right, of course. And then your approach as an integrative medicine doctor is for treatment. The treatment would be
Well, if the it depends, right? So sometimes it's not even about the treatment; it's about the interview. What I do is that if
sure.
you come to me with anxiety and you want to manage that with herbs and supplements, I'm not going to just give you here's some L-theanine and ashwagandha and send you on your way. I
Mm-hmm.
will want to know what makes you anxious and dive a little bit into that as much as time allows, and then give you a prescription, an herbal prescription, a referral for acupuncture, massage therapy advice,
Nice.
and then maybe I'll refill your antidepressant if you're in between psychiatrists. So that's the beauty of being able to be integrative. I can prescribe whatever I feel necessary, but I can also
Mhm.
go with the holistic basket of therapies.
So, what other types of therapies? I think you mentioned a couple of them. Do you refer your patients to?
So one of the big therapies that I offer is natural products, pharmacy type of advice. For instance, herbal formulas, ashwagandha for stress, as I had mentioned, or CBD for someone who's got pain and can't sleep, or maybe St. John's wort for a depressed individual who can't tolerate prescription antidepressants but wants to take something. But they can't be on birth control at the same time because they can interact. And so you have to think about all the different potential interactions when discussing natural products or dietary supplements. So that's one therapy. The other is I refer to a wonderful team of traditional Chinese medicine practitioners. So I have acupuncturists. We're all under one roof. And so we share patients if they want to go down that path, or if I feel that's important. For instance, like a patient desiring fertility optimization, I'll have her do weekly acupuncture. Another approach with massage therapy. So what's really nice is like I have the luxury of these great people where I don't have to do acupuncture myself on patients. I'm not going to do massage therapy. I share a team because, again, no one person can be everything. You asked about some other therapies as well as medical cannabis certifications and advising people on what kind of products should you purchase from a dispensary, some of the hazards of cannabis as well as the potential benefits. Other therapies as well, homeopathic medicines. Not all integrative physicians feel comfortable with that, but homeopathy is different than herbal medicine. It's its own category. So trying to prescribe remedies that fit a person's constitution or their symptoms while combining it with their herbal formulas and making sure it doesn't interact with their medications. That's all of that stuff is going through my head when I'm putting together a treatment plan.
Okay, that makes sense.
Okay. So, a lot of patients come to you after they have seen like a ton of specialists for anything that could have been wrong with them. Um, and I hear it all the time, besides the fact that people come out from an appointment with you and they're like, that was the best appointment I've ever
Oh,
had in my life, which we hear all the time.
Stacey must be a fan.
I'm a fan. I'm a fan. But I do hear that people are like, I've been to Mayo, I've been to MD Anderson, I've been here, I've been there. And it wasn't until I got to Dr. Temple that I started seeing a difference. What do you attribute that to? What are you doing? What magic are you doing in your office?
Such magic.
No, let's not give all to me. So by the time someone's been to May and all that, I get the benefit that someone else did all the workup. So I don't take someone from scratch and work up their abdominal pain and figure it all out in one visit. Sometimes we can, or I'll send them for a scan and you can see, oh, you have appendicitis, go to the ER. I don't have herbs for that. You need that cut out.
Yikes.
So, but I have the advantage of being able to look at all the workup. And so I'm like, okay, it's not this, it's not that, it's not this, it's not that. So I get to look smarter. So I'm going to give my conventional colleagues a lot of credit because they did all the hard work with that piece. And it's a lot of work. As any of you know that's been through some sort of medical workup, you feel like like just a piece of meat running to all of these tests, and then eventually you're told what it is or isn't. What's tricky is when the patient is when the person has a symptom and they've been through so many tests and none of the tests are showing anything's wrong with you, and then you feel like you're a crazy person, or maybe unfortunately made to feel like you're a crazy person and then sent to psychiatry for whatever's in your head causing these symptoms, when it could be a gluten sensitivity that was negative to celiac blood tests, but it turns out you're just that shy of a blood test showing up, yet you can't tolerate gluten. So I'm like, go off gluten for a month, and suddenly I'm a miracle worker. So honestly, that I will never take credit for fixing people. I've never liked that pressure, because you also have the pressure to perform miracles every single time something comes up. So
Right.
oftentimes you just have to, I go where someone else may have not. And then, and much of the time, there's a dietary issue. There's something that is triggering a person. And if it's not dietary, then it's getting to the bottom of the underlying stressors in that person's life, whether they need a jobectomy, a husbandectomy, whatever it is.
Sure.
And
Right.
I,
Changing their life circumstances, right?
yeah, I mean, sometimes it takes a drastic change, and then
Right.
the health gets better, and you realize how much stress isn't some excuse for everything. Um, Sometimes if you want a big change to happen, you have to make a big change. Other times it's more subtle, or we find it, and for some reason, it just wasn't picked up. Like, oh, this person's pre-diabetic, and that's why their infections and they're not losing weight. And or maybe a woman is 43 years old and she is starting to experience perimenopause, and it's subtle, and everything looks normal on tests, and you're kind of, well, maybe this is just the beginnings of your perimenopause, and that's why things are a little funky for you. Let's try some holistic therapies. So you just have to listen deeply. And again, I have the benefit of a little more time. I don't have 2-hour consults. I have 1 hour new consult and 30-minute follow-ups. So I still feel rushed during my visits, but um, you know, we need to inculcate that into our trainees. And we actually have a nice residency program, family medicine, that comes through and learns holistic therapies while they get a great education in their conventional training. And we're just constantly needing to educate.
Do you have a story that you like to share, like a win that made you feel really good?
Oh gosh. Yeah, you know, it's something, well, since red yeast rice comes to mind, I remember a while back, I have a patient who has or had fibromyalgia, which is a painful condition, all over joint pain, and it cannot be explained by any other reason. You can have arthritis and fibromyalgia, but it's a dysfunction of like the nervous system over interpreting pain and
Mm-hmm.
blowing it up and making it way worse. You can take a person with fibromyalgia and poke them like about that hard, and that really hurts. Where it's like
Oh,
that's nothing for someone who doesn't have those issues. So the nervous system's very painful. So imagine if the side effect of a statin is a lot of, potential muscle pain and cramps. Do you think a person with fibro is going to really be excited about taking a pharmaceutical statin?
no.
No, right? But what if their cholesterol is 300 and their LDL, the bad cholesterol, is 190, and they have heart disease in their family? What are you going to do as a physician for that patient, right? They've got to be on something, and they can't exercise very much because it hurts, and they're already eating a little. They many times they'll say, I barely eat anything. I can barely keep my weight. So there are some next best alternatives. If the person can't tolerate a statin, then you go where the natural origin is, which is red yeast rice. So my patient with fibro, I put her on that. Her cardiologist really wanted her to be on something and insisted. And she's like, she either tried it and it failed, or she just could not tolerate it. We put her on this. I'm like, you got to be on something. Put her on red yeast rice, and I think her LDL went from like 190 to 100, like dropped a whole
Wow.
lot.
Okay.
So that was exciting. That was one of my first experiences with that particular supplement. But keep in mind, red yeast rice, you got to get it from the right manufacturer that tests their products for purity. There can be a component in there called citrulline, which can harm your kidneys. So you don't want to just get any brand of red yeast rice. If you check with your doctor, they're going to just tell you to get off of it if they're not comfortable with herbs and supplements. And that's why you want to find someone who is on the integrative realm, that has herbal medicine training. And so hard, you can't see that from bios, but I would say if you saw integrative or the term functional in their name, there's going to be knowledge about herbs and supplements.
Okay, great.
I do have to
Thank
say,
you.
my new internist, she's on the younger side, and she was
Mhm.
very open to the
Mhm.
herbs and the red yeast rice. She's like, "Oh yeah, take the red yeast rice." I was like, "Oh, you know about it?"
Yeah.
So I think there is some movement happening.
Fingers crossed. That's
Yeah.
great.
And by the time a patient's seeing me, we're going to try different things. And I always copy their primary or their specialist to say, here's what I'm doing with your patient, just so you know. And that kind of
That's great.
connection also increases their confidence in integrative therapies. I think one fault of the holistic communities, we're not communicating with the conventional docs. And so there's this just, we don't know. It's very otherism. You guys are just these others. But if you actually knew who that person was and that they're a make sense person, we all have the same goal in mind, is to help the person in front of us be healthier and get over their disease state or situation.
Do you feel like, since you are part of a very large, well-respected hospital system, that it gives you some more clout, credibility with the regular doctors that you work with within your community?
Absolutely. I mean, we have a lot of standards for um, keeping our privileges up, and there's 360 in degree. The specialists see what my notes are. If I started to stand out and not kind of go on my own and do things that could potentially hurt people or discourage people from treatments that could help them, or not explain the rationale for diverting them, then someone would have said something and I would be up for review. You have accountability to your professional colleagues, because that's the whole thing about working as a team.
Switching gears a little bit. So I feel like people are talking about menopause and perimenopause all the time now, which is good because for so
Right.
long nobody did. Do people come see you for perimenopause and menopause questions, treatment? What do you do differently than their OBGYN, for example?
Well, the disclosures, how I'm talking to a doctor who's going through menopause really helps. Like, that's a really key. And yes, I see a lot of women going through the transition.
What can you offer for them that's different
Oh,
than their traditional OBGYN?
okay, so I mean, your OB/GYN can offer and probably will offer hormone replacement therapy. So I do a lot of overlap with that, ensuring that we're using the bioidentical form of the estrogen, which is estradiol, and progesterone, sometimes testosterone. And the way it's delivered to the body is really no different than what your traditional OB/GYN would order. Where I differ is that I don't use any of the synthetics or the horse-derived formulas of estrogen, like Premarin, which is pregnant mare urine. And yes, they are made pharmaceutically. We know what's in there exactly. I mean, there's always pros and cons to any formula recommended, but I'm using, it's really not much different. I'll recommend the estradiol patch and oral progesterone. Typically, that's my offer. Where it might be different is if I have a patient who really wants a tight control over their hormones, I might have a compounded formula with creams where they put from a specialty pharmacy a unique ratio of estradiol or estriol with their progesterone. If they want it all in a cream, we'll tweak, the percentages. I have found that to not really be super necessary, because most of the time the standard formulas from the pharmacy, which are bioidentical, seem to work really well. But I have still those patients that just, they want that, they prefer the cream. Um, and I think where I also differ is I'll use estriol a lot more than the conventional OB/GYN.
What about for your patients who don't want the hormones, aren't allowed to take the hormones?
Sure.
Do you have other options for them that traditional doctors don't?
Well, hopefully traditional physicians will think about Chinese medicine as like a great non-hormonal way to help ease those fluctuations during menopause or perimenopause. So I'll refer to our practitioners. So Chinese medicine's a really big piece in helping with hormone balancing, among many other things. Um, yeah, I think that's
It's
probably
like
where I go.
acupuncture and
Acupuncture, Chinese herbal medicine. And
herbal
I forgot to
medicine.
mention too that I also use Western herbs like chasteberry tree,
Mm.
And maybe, I don't know, depending on whether the person can't sleep very well, maybe some CBD in the evening,
Mm-hmm.
L-theanine for the anxiety, magnesium for muscle cramps and
So there
joint
are lots of
irritation.
Beautiful
options
things. Yeah.
Yeah. And they're
for
not,
whether,
those are hormones.
I don't mind sharing. I take chasteberry because it helps with my PMS symptoms, and
Mhm.
I think it's great.
Great.
Take
It
it
has
every
an
day.
evidence base.
Helps with my. I used to get headaches before my period. I don't get the headaches. I don't get the cramps as bad. It's really nice. So everyone's different, obviously,
Sure.
but I
But
thought,
chasteberry tree, fun story about chasteberry trees. You see the word chaste,
yeah.
chastity.
Oh,
So that was its nickname is monk's pepper, like a Christian monk. They would use chasteberry extract from the bush and it would help suppress the male libido. So hence the word chaste.
huh.
It could honor their vow of chastity. But for women, it seems to help with the PMS symptoms and the hormonal fluctuations. So I
Yeah.
think it's a fascinating
it is.
historical
It's an
That
interesting
is
story.
interesting. That's
Yeah.
funny.
That's great.
Well, let's jump to. I really want to. I'm interested to hear about hypothyroidism. So, Stacey, I had as a question for you about that because you
Sure.
are an expert on that. I understand you wrote a chapter in a
What
textbook.
about-
Well, you wrote a chapter in a textbook,
Yes,
and they're
yes,
teaching it, so that's exciting.
Yeah,
Okay,
tell us about that. You wrote the
yes, please.
chapter on hypothyroidism in the Integrative Medicine textbook.
right. By Dr. David Raquel. The reason when I originally got that book chapter offer, I was offered a variety of topics, so I picked something I knew very little about. So in conventional training, I learned, okay, this person's TSH blood test is off, give them levothyroxine, and you're done. And then make sure the labs look okay. That was about it. And I felt that there was much more to it. And as I took that chapter over, it forced me to learn all of the nuances of, the conventional treatment and holistic therapies. That was also like politics. There's the what your doctor doesn't tell you about thyroid. You've heard of that series of books. And then you have the very conventional endocrine society and totally different stories going on with how to treat a thyroid. And like I said, truth may be in the middle. So I decided to dive into the controversies of what's a normal TSH and what's the difference between generic levothyroxine and armor thyroid, which is the porcine, the pig-derived thyroid gland hormone replacement, and natural versus synthetic. Oh my gosh, just that topic alone really spurred me on to write the first edition, and then every time the book gets updated, about every 3 or 5 years, I'm on now the fifth edition of writing that chapter. So I update it every time, and that forces me to keep up with the latest. So that pressure I put on myself helps me be an expert in my own mind. But actually, I think it has worked. And you sort of get, known for thyroid. And I'll work with the endocrinologist, or if a patient has an endocrinologist, I'll be like, let them handle your thyroid. We don't need like two cooks in the kitchen on that. I will manage then your digestive problems or the anxiety or depression.
Are there things that patients can take that are natural if they don't want to be on some of the synthetic thyroid support? Do they replace them? Do they complement them? How does
So your
that work?
thyroid is a gland sitting in your neck, and it's governed by your brain tasting how much thyroid hormones the thyroid gland is making. And there are nutrients that help promote either the formation of the thyroid hormone or its conversion to its active forms in your tissues. Iodine is probably one of the most important. And so iodine is prominent in seaweed and in fish. We also have iodized salt. So in countries that put iodine in their salt supply, you don't see that the iodine deficiency that can cause goiters in countries that don't have programs like that. But that is improving. WHO has been working on that. So the most common cause of thyroid problems are autoimmune conditions, your body attacking its own thyroid, and that's known as Hashimoto's. So you can actually, if you suspect this, ask for the TPO antibody test to see if you have a thyroid autoimmune condition. It's like, why are we hypothyroid? As well
Right.
as, okay, how do we treat it?
The underlying causes,
Yeah,
right?
so underlying causes could also be genetic, which you can't change. But if you have an autoimmune condition, maybe you go off gluten and dairy for a month and see how you feel. And then if your thyroid is still limping along, then you still need some thyroid hormone support. And then I'll go through all the various medicines for that. So other natural treatments to help promote thyroid hormone function besides iodine is selenium, which you can get from eating 4 to 6 Brazil nuts a day, or you can get a supplement that has some selenium in it, as well as some iodine. We don't want to go overboard on either of those. Vitamin A, zinc, what else is important? Iron in the diet, or if you're iron deficient, taking iron if you need to, if you're vegan or vegetarian. There's a lot of cofactors that make thyroid hormone and help convert it to its active state. So you could probably boil it down to eating seaweed, fish, and Brazil nuts. And if
So
you're
should we
allergic to
all
all,
be trying to
I love
protect our
that.
thyroid by eating some of these things? Should we
I
be
don't think you have to.
conscious about it or not unless we have to worry?
I don't think you have to have that on the front of your mind unless you
Okay.
know you have a thyroid condition.
Okay.
And otherwise, we're gonna like, why do we need to eat so much Brazil nuts? I always worry about creating like these superfood crazes.
Right.
And
I
you don't want to eat too many, right? You don't want to have too much selenium. So
Right, you can have
just a few of them.
hyperselenosis. Yeah, hyperselenosis can also be a somewhat toxic situation. It's not really that scary, but hyperiodism, hyperiodine state can lead to problems with your thyroid, the very gland you're trying to help. So never go overboard on anything. Levels can be checked, or at least just whatever you get in your diet, as long as you're not eating pounds of Brazil nuts every day and like bushels of seaweed. I mean, you know, remember what I said about extremes.
Right.
So
Okay.
that was to answer your question about natural therapies for thyroid.
Yeah.
What question did you have, Missy?
Oh gosh, now I don't remember.
Sorry.
No, it's
That's all
fine.
right.
Oh, so autoimmune conditions, like you said, which can, and with the thyroid, it leads to Hashimoto's. And autoimmune conditions, typically, it's your body's immune system sort of overfiring and then attacking itself, attacking our body, right? And so the
Well,
idea is to calm down the immune system.
right.
Okay. And
So
and
what can trigger your immune system to go off? A virus, right? You catch a cold. You want your immune system to fire up so you don't get sick and, get meningitis and die. Like these are
right.
everyday things. Or a cut on your skin should not turn into some skin infection that then becomes a blood infection, you're septic and die. So all these systems are in place to protect us from harm. But when your immune system is just acting up and looking for like friendly fire, shooting off like friendly thyroid cells and rendering your thyroid gland less capable of making thyroid hormone for circulation, then other triggers besides a virus, which we always want to avoid if we can, are certain foods. And probably our two bigger culprits are dairy and gluten. So we don't have to test you for it. Go on a 1 month, no dairy, no gluten adventure.
See how you feel.
Test it. Yes. And if you're like, oh my gosh, I really missed my yogurt, you pick the favorite food you missed the most and you add that back to see if it triggers feelings of hypothyroidism, which I'll get into. And if that doesn't make you feel worse, then maybe you're not dairy sensitive, but then eat gluten. And if you're like, oh shoot, after day 2 of eating gluten, my joints felt achy. I got this weird rash. I feel foggy brained. I feel bloated. I don't feel right. Got to give it a 3-day evaluation period when you do an elimination rotation diet.
So it
So
sounds
that's
like if a blood test can't tell you something like you know, your body, your immune system fires up when you eat dairy or when you eat gluten, you just try things out and see how your body responds. Sounds like that's a really good.
straightforward.
I feel like everyone feels better when they go off gluten and dairy. It's just a really hard way to live. It's a
Mhm.
big commitment, but I've never heard anyone say that they felt worse after removing them.
I have.
You have?
I have. Not dairy. I haven't had anyone say I felt worse. They felt sad. I think
Sad. Definitely sad. It is a sad thing.
Yeah.
lost joy. But I've had patients who maybe when they tried to eliminate both, they they felt worse and they felt better when they ate the foods. And I don't know if it's because they were
Interesting.
substituting with something that wasn't so good for them, or those foods actually were pretty nourishing for them. So I
Okay.
like, again, everyone's different, but you could probably bank on a lot of people probably would feel better not eating gluten. or limiting it. Because think about a really glutinous food, a donut. Okay, well, there's a sugar. Let's not ignore that sugar is a big culprit.
Right.
Overindulging in sugar. That might be why people feel better too. They're better because they can't have donuts, you can't have sugary cereals, too much bread, desserts of any kind.
Right.
Well,
All the
no,
good desserts.
you can have gluten-free desserts. But I remember eating a whole package of gluten-free ginger snaps, like the whole bag.
We've all
Rotten.
done it.
I felt rotten afterwards. So don't forget about sugar.
Yeah, sugar.
Yeah,
Sure.
that's so true.
Thank you. Yeah. Okay.
So, Dr. Temple, if you could give our listeners just a simple action item, something they can take away from today's discussion, a change they can make in their life, what would you recommend?
Weight training. I would say like the focus on, then if this is like more of a perimenopausal group, get in the best shape of your adult life now. It will not be easier as you get older. So you're never younger than you are in this moment. And one way that has been like a game changer for me, and it's really simple, is I schedule my workouts like on my app, like I would a doctor's appointment, and have that much reverence for keeping that appointment. I go to a group fitness class. I go to Orange Theory, for instance, and you can book your classes way ahead. And so now it's like just on my schedule, and I go. I don't want to go 6 a.m. That's my only time. But if I don't go, then I don't feel so great. And then it's easy to fall off the wagon. So 2 to 3 sessions of some sort of weight training, whether it's in a gym or at home, keep your muscles strong and don't fall, because you want to be that person in their 70s and 80s, I think, that could still travel and not need anyone to help them with everything. Stay independent, keep your mind sharp. Exercise, weight training is probably it's so important to keep you healthy. And then, of course, eating healthy most of the time, 80% of the time, do a good job. So that's the rule, 80-20, do a good job.
Love it.
1 in 5 times you can be your indulgent self, be a little lazy, but
Have the bag of sugar snaps, ginger
Yeah.
snaps, ginger snaps.
Yeah. But then you got to go for a nice long walk, and don't
Yeah.
don't
Oh, yeah.
develop a complex about it. So you get a B minus, a B on your performance your whole life versus an A plus for 3 weeks, and then a D the rest of the time. Be consistent. The other thing
I like that. That's a good
Yeah, that's
analogy.
good. I agree.
That's why I've never been someone who's you've noticed a theme of no extremes with me. So technology is also very good way to measure progress to keep you on track. And I noticed when I took creatine monohydrate versus last year when I did the same kind of 3-month program, I put on more muscle than I did last year, and I worked out about the same. And I was younger last year, so I'm like older,
Yeah.
about the same, but my muscle mass went up, which I thought, okay, and that's where I did an evidence review of that, and it does show that you can build muscle. You just can't use it if you have kidney problems. So you don't just take it unless you know that your kidney functions normal. That's a simple blood test that you usually get with your physicals, and it has a diuretic effect. So,
Yes, it
be
does.
prepared for
Oh, I
And
just
go
thought
to-
it was because I was drinking more water. I put it in my water. So I was like, well, I'm drinking
water.
more water.
You're drinking water, so that's going to obviously make you urinate more often, but I think it has a little extra something. So it's not stimulating or anything. It's just like caffeine, but just be wary that
We
you
go
might
through
be
a lot
going
of creatine at my house. Every single one of us, all 6 of
the
us.
teenage boy. Oh gosh,
The
this is
teenage
the
boys.
question I got. This is the biggest question from our young people. Is
Yeah.
creatine okay? Probably, but make sure you check with your doctor.
And in the
that
right
you don't-
amount. The right amount.
Yeah, don't
Yeah.
overdo it. More is not better.
Yeah, that's great. Missy,
Great.
you want to
Thank
ask
you.
our last question?
Yes, thank you. So, Dr. Temple, here at the Digestible Podcast, we like to say, don't panic, just pivot. Would you be willing to share with us a small change in your life that you've made that has made a big difference?
Well, I feel like it was that small change. You could probably use the scheduling my workouts in it as a business, as a
That's great.
an appointment.
Yeah. Putting it in your calendar. So like any meeting, oh, it's time for my this. I'm going to go.
And be
Okay.
penalized for it heavily. I'm joking, but if there's a penalty for late canceling, you actually pay money for canceling too late.
Oh, at Orange Theory. Oh,
Yeah.
so like an accountability system.
Oh, sure. Like
So
you
a
have,
gym that'll penalize you
it'll ding
or
you if you cancel too late. And I've done that every so often. Like, oh shoot, I overslept. But I know around 10 p.m. the night before, because I have a 6 a.m. class. If you cancel before 10 p.m., there's no consequence. But if you cancel at 10:01, I get charged $12. So I need that little level of punishment for not going
Mhm.
to get me going. And then the next thing I know, I'm just scheduling out, making standing appointments for yourself, including also massage therapy, anything that's self-care, even your hair appointments, just book them out in advance and you plan your schedule around it so you don't forget, oh gosh, when's the last time I had a haircut? When's the last time I got a massage or did something nice for myself? Start like peppering them into your schedule regularly as budget allows and time allows.
That's
I
great.
like that. Prioritizing yourself. That's important.
It
I think
is.
people forget that sometimes, especially if you're a busy parent, if you are busy at your job. It's easy to overlook yourself or put yourself at the bottom of the list of things to do.
And if you book it ahead of time, then you'll plan your day around it versus coming to a busy day and going, where can I fit a massage? It's too late.
Thank you so much for being with us today. We have loved having you. You're like my favorite celebrity doctor.
Oh, no.
A celebrity doctor guest on the podcast. Thank you for being. This was great. Thank you for listening to the Digestible Podcast with today's guest, Dr. Leslie Mendoza Temple. Did you like today's episode? Then please share us with others. It's the best compliment you can give us. You can also send us questions or comments to info@digestiblestrategies.com. We look forward to hearing from you. And remember, don't panic, just pivot. The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.